As COVID-19 vaccinations begin here in the U.S., a new survey out today indicates mixed opinions among Americans when it comes to getting vaccinated. In its latest report, the Kaiser Family Foundation finds 71% of those asked say they will definitely or probably get a COVID-19 vaccine. However, nearly 1/4 of the adults asked said they probably or definitely would not get a COVID-19 vaccine, even if it were available for free and deemed safe by scientists. Joining me now on Skype is Dr. Bob Lahita, professor of medicine at New York Medical College and chairman of medicine at St. Joseph University Hospital. Dr. Lahita, welcome. Thank you so much for coming on the show. There's a lot. Thank you so much. There's a lot we want to get to, but I want to start with the Kaiser Family Foundation survey that I just mentioned. The findings that is, appear to indicate that despite the positive messaging, there is still some skepticism when it comes to the Pfizer vaccine. Why do you think that is, and do you think those concerns are valid?
I don't think those concerns are valid, but I do see, and I was very surprised prior to what you just said about the Kaiser Foundation study, that over 50% of the public in the summertime during the surge then did not want to get vaccinated. Now that the vaccine is available and is with us, that number has fortunately gone down. So more people do want to get the vaccine. But there's still this very recalcitrant anti-vaccine group that's out there, and it makes absolutely no sense since this is such a lethal disease and the vaccine is so safe.
Dr. Lahita, what would be your message to those folks who are hesitant about getting the vaccine?
This is a new vaccine which is molecularly designed. It is not a weakened virus. It is not anything that's dangerous. You're not getting anything that's living injected into your body. You're getting a nanometer-sized vesicle which contains genetic material from the coronavirus. And it's going to fool your immune system into thinking that you have been infected. And so you're really getting something quite safe, quite new, and quite revolutionary, which has a greater than 94% sensitivity, and the effect is terrific. It is beyond any vaccine that we've had, such as influenza, measles before.
As you know, the FDA released its review of data on the Moderna vaccine. What do we know so far about its effectiveness and possible side effects?
Well, we know that the Moderna vaccine is quite effective. It's almost as, or it is equally effective. I'm thinking it's 94, 92% effective, like the Pfizer vaccine. So Moderna is a similar vaccine. It's, again, the lipo nano compartment with a genetic material in it from the COVID-19 virus. It is extremely safe. It also has to be kept cold, but not as cold as the Pfizer vaccine. The Moderna vaccine is given 28 days apart, and the Pfizer vaccine is given 21 days apart. So there's 2 injections for each of those vaccines. And after it goes through the FDA, you know that the data have been carefully scrutinized, and this is exceedingly safe. And it's very important that we get this vaccine out to everybody.
Yeah, another thing we also learned about today is the FDA gave the thumbs up, so to speak, to the first at-home coronavirus test that's available without a prescription. What more can you tell us about that? And do you think that'll be a game changer when it comes to curbing virus transmission?
Well, there were a couple of at-home tests, but I think this is very, very exciting. And because the at-home tests that I'm aware of are the saliva test, which is excellent. And then we've got the breathalyzer test, which is quite novel, actually, and developed in Southeast Asia and Korea, where you actually breathe into a tube and change the resistance of some small resistant balls in the test tube. And so these 2 tests are very rapid fire. I don't know specifically which test you're referring to, whether it's polymerase chain reaction based or immunologically based. I would need to know which test it was.
Well, either way, Dr. Lahita, a lot of exciting news on the vaccine front for sure. We appreciate you coming on the show. We really appreciate your time and what you do. Dr. Bob Lahita, professor of medicine at New York Medical College and chairman of medicine at St. Joseph University. Thank you again, doctor.
Thank you.